And it is in this prostate that
it is important that you do that you go for your checkup so that.
Hello guys. I'm with Dr.
BESA.
We are going to be talking about prostate cancer. So when you talk about prostate, you're talking about men. Just like when you talk about cervix, you're talking about women. So the prostate is the walnut-shaped gland that is directly under the bladder. That's for men, okay? And it is in this prostate that the seminal fluids are produced. Seminal fluid is responsible for transportation and nourishment of the sperm, okay? Because the sperm is produced somewhere else, the seminal fluid will come mix along with it so that the sperm will not die. It's the one that will feed the sperm food. It's the one that will help it give it the liquids to move. The way you became a winner, you know, in your mother's hair. This prostate cancer is the second leading cause of cancer death in men after lungs cancer, cancer of the lungs. It may be treatable when you discover on time. If you're older, you should right now know exactly the test you go and run in the hospital. Then if you're younger, you should be preparing yourself as against the future, what you're supposed to do. So I really hope this video is going to teach us a lot, and relax and let's enjoy this video.
Welcome to Helene's Corner.
Now, the first question is, what is the cause of this prostate cancer? Every part of our body is made up of cells. Like we know, cells is the basic unit of life, and cells grow and they also die when it's time for them to die. What makes up a cell is our DNA and our RNA, is everything in our genetic makeup. The DNA is responsible for production of new copies of cells. So the cause of prostate cancer now is when the DNA in your prostate now is now making an abnormal cells instead of the normal cells of the prostate gland. It's not producing an abnormal cell, and cells are meant to die. These abnormal cells will not die, and because they will not die, they will now start forming a tumor. A tumor is called an abnormal growth. When it now start forming this tumor, gradually this tumor will start expanding. It will leave the prostate, start getting to other parts of the other organs that are very close to the prostate. Before you know it, it is spread to the entire body, and it could even lead to death. What are the symptoms?
It has to do with bone pain. There's no bone pain because of the location of the prostate. It's located below the bladder. Also, there could be spine compression. Another an important symptom that shouldn't be missed is the change in the urinary stream for men. You find out because it's found below the bladder. It's the enlargement of this organ will cause stricture or narrowing of the urinary tract. So this can lead to dribbling. That means the person is maybe after eating himself, the urine is still dropping. That's dribbling. It can also lead to low stream. Remember, the urine is trying to pass through a slimmer route. Unlike how wide it narrows the urethra. So normally when men pee, there is a stream that is expected of the urine to go before it comes out. But you find out that there is no stream, there is no water pressure because of that thinning of the urethra. Also, there could be, in advanced cases, there might even be blood in the urine. There could be pain on ejaculation during sex, or pain on ejaculation, because we know that the sperm too passes through the urethra. Another symptom could be erectile dysfunction. Remember that the prostate gland is a part of the male reproductive organ, so there could be erectile dysfunction.
In case you don't know what erectile dysfunction is when you want to do something, you just even want to start. It will not even stand up, not to talk of to be ready to do it. That's what erectile dysfunction is. Okay, the risk factors for prostate is older age. That's why once you're up to 55, it's advised that it should be part of your yearly routine test as a man. But once you get to 40, every 2 years or 3 years, you can start running this test. So if you're up to 40 and you're watching me now and you've not run this test, please hurry up and go and do it, because the earlier you discover it, the better for you. They'll be able to cure it. But if they discover it late and they now perform what they call surgery, that place might not even stand up again, and at times sef it might even be late in such a way that there is nothing they can do about it. All you need to wait for is just your time. So another risk factor is race. It is believed that black American men get it more, and you know black America is believed that they are of African origin. So as African men, we are supposed to be working so hard to check ourselves because we are also at risk. Then another risk factor is family history. Like if it's believed that if your dad died of something like that, you as a young guy should be prepared that once you get to an older age, you will start checking yourself here. And the final risk factor is obesity. When you are too big, that is overweight, this thing can lead to prostate cancer. But for the sake of your wife, you know, you start watching your weight on time. You exercise like 3 to 4 times in a week. Reduce your weight drastically, because once somebody is big, the tendency of not just even prostate, so many illness, it becomes so high. So please watch your weight if you're at the big side.
The diagnosis of prostate cancer or prostatic enlargement is usually accidental, especially in our clients, because we do not do routine medical check. But like my friend has said, it's important that once you are 40, you start doing routine medical check and make sure that your prostatic health should be one of them. So it's usually accidental in that maybe the person comes complaining of low stream urine or dribbling or increased frequency in urinating. These are all the symptoms, and maybe the doctor now decides to do a digital rectal examination. So that is when the prostate is now felt on the wall of the rectum. So that is the major way that is diagnosed. But it's important for us to know that a prostate can just get enlarged without it being a cancer. That's what we call benign prostatic hyperplasia, which means just an enlarged prostate. And that's where it is important that you do a biopsy. So these are the things your doctor tells you. You do a biopsy. You also do a blood test to check the level of what we call prostatic specific antigen, BESA. So it's the level also that can guide your doctor to suspect whether it's just a prostate that is enlarged or is a cancerous one, because one of the causes of enlarged prostate is continuous production of the male hormone dihydrotestosterone. So it keeps sending signals to the body to produce more cells in the prostate. That's why you can actually have an enlarged prostate that is not cancerous. So it's not when you do a DRE, that's a digital rectal examination, you are told that it's enlarged. Don't get scared. Just go for further tests so they can differentiate it from the other one.
Once your prostate is enlarged, don't start saying, "Oh, I have cancer," until you do a biopsy. It's biopsy that is the confirmation of yes, this is a prostate cancer or this is not. Because it's when they take the tissue to the lab, they will not be able to check if it's malignant or it's not. Then they will not tell you, and then the next step will be taken. But the earlier the better. In fact, go after this video.
Other tests that can be done to help diagnosis is ultrasound and X-ray.
Yes. Prevention, just healthy living in general, whether it's supplements, you eat more of fruits, more of vegetables, things that will help to discharge anything that is not supposed to be in your body to go out of your body. Things that will help. If you've noticed you've not had bowel movement, you make sure that you eat more of fibrous food so that it will excrete all the things that is supposed to go out of your body, not that one will go and pack somewhere, and before you know it, if it's not colon cancer, it's prostate cancer, or it's one thing or the other inside your body. Number 2 is exercise. This exercise is just your life. You just need to incorporate exercise. At least, even if you don't have time, make it once in a week. Even if it's on Saturdays, just make it once in a week.
Even if it's a few minutes,
yes,
it's
something. It's something. Even if it's 2 minutes. In fact, as you're watching this video, when you finish watching this video, you've not exercised since for the past 1 week. Just leave this video and start jumping. Jump 100 times, then stop. You know, it's something. Do more of exercise so that it can help take out toxins from your body and keep you what? Healthy. So exercise, and my next point goes hand in hand, which is maintaining of your body weight. Okay, if you don't know how to do exercise, you can just maintain your body weight by dieting, portion control. If you take like 2 spoons before, you reduce it to 1 spoon. If you take 3, you can reduce it, start by 1.5 instead of going hungry completely. Just reduce what you eat, make it smaller quantities, so that what you'll be able to watch your body weight. Then the final one on my list today is for you to go for what? Checkup. Because if you don't see your doctor, how will you know exactly what is wrong with what? You. Early screening, that's when you'll be able to know exactly what is wrong with you. If there is a problem, you arrest it on time, because prevention is better than cure.
For treatment of this prostate cancer, remember, like I told us earlier, the treatment varies from person to person. It varies based on the person that has it, and also based on the stage of the ailment. So it's important to know that the treatment options include chemotherapy, hormonal therapy, radiotherapy, and even surgery. Surgery is usually the last resort. So it's just important that once you feel anyway, or before you even feel anyway, that you go for your checkup, so that diagnosis can be made on time, so that the first line of treatment will be the one that will be used for you.
So guys, each time you see me and Dr. BESA, please try and visit her channel. There will also be another video that we'll do together in her channel. And then guys, please like this video, share, so that we
subscribe to the channel.
Grow. Yes, subscribe if you're new. And we'll see you guys in our next video. Bye bye. Love you.
Thank you for watching Helen's Corner.